Greetings. My name is Mary Kinney at the School of Public Health at the University of the Western Cape. We are supporting Countdown to 2030 on understanding health policy and systems drivers of reproductive, maternal, newborn, child, and adolescent health. Health policy analysis systematically examines the factors, people, and processes that impact the way a policy is developed, formulated, and implemented. What is the purpose of the tool? Well, this tool aims to document changes in a country's health policy, programs, and implementation over time, and provide a basis for reviewing how these changes have contributed to health inputs, outputs, and outcomes. The tool has three main objectives. First, it is used to describe what has changed. By using a standard template, the tool provides a way to chronologically document what policies, programs, and implementation strategies, as well as pivotal moments, have changed over time. This output is often shown as a figure of a timeline. The second reason to use this tool is to analyze and assess the variation of policies and strategies at different levels: national, subnational, facility, community, highlighting periods of policy and program intensity for an issue. The third reason is to use it to inform conclusions and lessons learned about why and how change occurred or didn't through the application of the tool, including through consultation process and stakeholder interviews. The components of the tool include a template of the timeline with the years and levels or components, and this is often done in Excel. You also should develop a protocol or instructions on how you're going to complete the tool, and this will include steps for drafting the timeline, the planned process for stakeholder engagement, and guiding questions to support the analysis. These components should be adapted and tailored to the specific needs of your research. So, for example, the tool used by Countdown to 2015 country case studies went from 1990 to 2015, and it included 6 levels. Whereas others may have different time periods they're looking at, or would like to look at different levels, such as the example that's shown on the slide. Likewise, the tool should include guiding questions tailored to the research aim and objectives to inform the analysis process. So therefore, the first step really is to develop a protocol to meet your needs. We have provided an example of a policy and program timeline tool for country teams to adapt, and it is linked to this tutorial. And you'll want to consider what adaptations need to be made. So for example, in this timeline, there is not private sector engagement, but this might be something that you would want to add. After you have your protocol, the process of applying the policy and program timeline tool includes first completing a draft of the timeline using your template. This requires that you collect information through a desk review, literature review, and expert inputs. And you may want to cross-check with other data sources, such as the World Health Organization's Maternal, Newborn, Child, Adolescent, SRHR policy portal. The second step is to validate and analyze the timeline with stakeholders. It is critical to consult country partners, ideally in a workshop setting, to allow for consensus around key milestones as well as discussion about the impact of the changes on outcomes. In my experience, the richness of using this tool is actually in the stakeholder engagement, because through this process, you're able to get inputs, consensus, and also see where opinions differ. The guiding questions in the protocol will then help facilitate the discussion, which should be iterative and context-specific. To make the process interactive, you may want to use a scoring process where stakeholders in the room rank their top 3 events, programs, and policies of influence, and then they present why they selected them to the group. And this can really enable a rich discussion for analysis. The discussion with the stakeholders really should be documented for the next step in the process. But if a stakeholder meeting is not possible, key informant interviews with stakeholders is also another way to get inputs on the timeline and their perspectives. So the final step in completing the policy and program timeline tool is to synthesize and present your results. This requires that you use the data from the tool and the stakeholder engagement process for a qualitative assessment of which changes were most influential for what outcomes. This will also require comparing policy changes with changes in your quantitative data, such as mortality, coverage, equity, funding, and any targeted area of the program. It will also inform the conclusions and lessons learned about why and how change occurred or didn't. Finally, you will need to develop a visual or a narrative summary of the results for sharing. Here are some visuals of how the tool has been applied. The first example is from the Niger Countdown to 2015 country case study. The second example is from the Tanzania Countdown to 2015 country case study. And you can see the similarities, but also some of the differences in how the information was presented. The final example here is from Saving Newborn Lives program's country case studies on change in newborn survival, just to give another example of how to visualize the information. But of course, the policy and program timeline can go deeper than just creating a nice calendar of policies and events. It really can allow for understanding the health policy process and is a critical complement to any quantitative analyses looking at change over time. You can find more information at the Countdown to 2030 Data and Analysis Center for Health Policy and Systems Change website at this website here, or you can contact me. Thank you very much for listening.